Okay, so we had a doctor's appointment today, and it wasn't really anything. They didn't even draw blood today, which is very unusual, but it just wasn't on the schedule. So I'm in the third phase of the clinical trial, and
Third cycle.
Third cycle. Sorry,
It's
not phase.
Phase 1.
It's a phase 1 clinical trial. Also, I was reading today a side note about my doctor. Another dear friend of ours who is a doctor was asking about my doctor and frequently just checks to make sure like my doctors are legit and stuff. And he was asking about my doctor, and I like pulled her up, and man, she's like an amazing like research scientist doctor, and she's like preeminent in this field for these stage 1 drugs and immunotherapy and all this stuff. So I'm so much more even excited than I think Kelly and I both are than we even were already for like what's going on. So the things they talked about today is they had the doctor that had done the 2 previous nerve blocks on me and did the biopsies and diagnosed my cancer. His name is Alejandro Pruitt, and he handles all of the like surgery things kind of with my pancreas. He's not like the pancreas surgeon for if part of my pancreas was like being removed or something for the cancer. Doesn't matter, whatever. This is like my pancreas surgeon guy. And so they forwarded my results of the last CT scan where they were concerned about the like hardening issue and maybe narrowing in my duct in the head of my pancreas, where the bilirubin is not backing up yet and is still okay and seems to be flowing well. They forwarded that information to him just so he could have an eye on it and a second opinion. The fact that he hasn't called me or scheduled any kind of surgical procedure is a good news.
Because he would be the one that puts in the stent or decides something needs to happen. So.
Yes, that was the purpose in sending it to him. He would be the one that would put in a stent. That would be the necessary procedure if my pancreas starts like closing off and not draining. So, and this is a result, they think, of the radiation. And it may heal, but it may be permanent scar tissue. It may also worsen. There's a lot of things it could do, and we don't know. Only God knows. So, but it's good news so far. None of those things have happened, and we're doing good. And I don't have to have a stent yet. Today, every single person that I encountered that learned that I was no longer in pain today was completely like excited. And my precious nurse, the doctor's nurse, was just like fighting back tears. She was so sweet and wonderful and loving and so excited. And she just like kept saying, I can't believe it. I can't believe it. She was like, I'm gonna cry. I can't believe it. Like, she was in awe. Everyone was in awe. They were like, I can't believe this pain is gone. So that's just huge. Like, everyone is so loving, and it's really important. It really means a lot to us. Everyone is just wonderful. They're wonderfully supportive of us. One of our main concerns is bringing me down off the fentanyl. We kind of want to get it over with quickly and safely, but ready for it to kind of be over and get off the gabapentin as well. I don't want to be on the gabapentin, especially if I don't need it. So my doctor brought me down to 100 milligrams of gabapentin today. And then in a week, I'll see her again. She's going to find out from the pharmacist if I can just stop or if I need to switch to every other day, how long this is going to take me to get off the gabapentin. And she's just going to double check so that can be done safely. And then she said she wanted to hand over my coming off of the fentanyl to the pain management anesthesiologist, who is the one who did this nerve block that worked, she felt like that this is his area of expertise. And so he called us in person very shortly after us leaving the clinic today. And he dropped me down another 50 micrograms an hour. He said, I see him in 8 days. So he said he will see me then. We'll discuss further dropping me down. He said he might drop me down to 25 or, and then completely off, or he may drop me down to 25 and then to 12 and a half and then off. He'll just probably just see how I'm like doing with it, and I think I'm gonna do fine. So I don't really foresee us needing to do 12 and a half unless I just need to stay on some pain medicine. My doctor today was also mentioned that she's not sure if she even wants me to completely come off of all pain medicine, like that I may stay on like a low dose. So we'll see what happens.
Yeah, it might stay on like 25, just regular.
Yeah, we might. So we'll just see like what happens. Even with the nerve block, there is like some like discomfort associated just having pancreas cancer. There is a tumor there, and it's on my arteries. And so, yeah, it's definitely relieved from the nerve aspect, and I'm in a lot less. I mean, I'm not in pain. I'm doing really great. So I'm very thankful. But I could see where it could be necessary to stay on a really low dose or something. I don't know. We'll see. We'll see what happens.
Yeah.
As long as it's not like this extreme high dose like I've been on, and that would be good. We'd like to not do that. A scary thing about that is it doesn't really leave anywhere to go. Like, when you have to have that kind of pain medicine just for like everyday existence, just to exist, if something critical happens if something further happens to the tumor on your arteries or your nerve bundle,
you're maxed out already.
You're already done. You're done. Like, if my pancreas completely closes off and backs up and becomes infected and I get septic or something, like, I'm done. I've already had like the maximum amount of pain medicine that I can possibly tolerate and live. So it's good to come off of it. It's good to be off of it and have at least wiggle room for anything that can happen in the future, which is a scary fear that's like always in the back of your mind. Once you've like encountered pain like this, and once you've had I've had a wonderful experience with the cancer center, but once you've like in the regular like medical community experienced a complete like disregard for your health or your life or your pain or anything, it's really scary. You're like, but what if something happens? It's hard to not like think about what if something happens, and like, just because we're human, we want to be prepared for the worst to happen, and we can't always be prepared. We have to trust God. So it's been a good day, good visits with the doctors, and it was good things. So
I mean, it's been a relatively rough week, even though you haven't had pain. There was like weird stuff with anesthesia mixing with your fentanyl, like Michael Jackson. How they
I didn't
killed
even
him.
I didn't even make, I don't know if I even made a video since then or anything.
No, you haven't talked about it.
I didn't. Wow, I had a really terrible time. So
it worked. No pain. That's the good part.
That is the good part. And what happened was I had propofol for my anesthesia to do the block, and the block instantly worked right in the office. On the way home, I lost my bowels all over myself. I got home and I'm pretty sure almost overdosed on all the fentanyl. I'd had on my fentanyl patches. Now I'd had this propofol. That's
this was
what
at the
kills like the rock stars and stuff.
Yeah.
is that combination of drugs. I had told the anesthesiologist who did this nerve block, this is the drugs I'm on. I wrote it down and everything that I had taken. And still, so when we got home, I wasn't having pain anymore. So instantly the fentanyl patches were too much. They were overpowering. And
then combination with the propofol.
Yes, in combination with the propofol, I stopped being able to breathe. I could not take a breath, and I was absolutely panicked. I knew it was like, and I was like dizzy and feeling my pulse in my ears, but also completely hot, covered in sweat. I was like, I'm about to black out and die. Everything's like closing in, and I can't take a breath. Like, I so much know what's about to happen. Callie was out in the garden, got Callie's attention. He got my inhaler, got me to be able to like take a couple of breaths. I haven't had to use an inhaler in a couple of years, by the way. He got a couple of breaths in me. I'd ripped all the patches off because I was like absolutely terrified. I knew what was happening. And then we called the doctor, and the doctor said put 100 back on. And we still waited like several hours. I was like scared. I was like, I don't want to put it back on. I'm really scared. And Callie's like, you can't just stop taking all the medicine. You got to put something back on. So we did. We put 100 back on. I had been on 150. And that was really scary. That dizziness, faintness, nausea, not being able to keep my bowels continued for the whole week. It's only now turning around, so where I feel kind of okay again. So yeah, it actually was a really hard week. I felt sick as a dog despite coming more off of the medicine, and I felt really weak, and
some of that's like going
absolutely
through
terrible. Yeah, so
there was a huge decrease.
Right, I'm in a weird paradox where I'm painless. I'm excited to get off of this medicine. I'm too high because I'm not in pain, and I'm on a high dose of fentanyl, and I am detoxing. So I'm
off the fentanyl,
Dilaudid, and Norco. So fentanyl wasn't even all I was on. I haven't taken any breakthrough pain since a week ago, and I'm like, I'm like detoxing. I'm having like this weird like reaction of both. I'm high and I'm detoxing. I'm like overdosing and detoxing at the same time. Doesn't make any sense, but that's what's happening. So I don't feel like I'm overdosing anymore. Especially like today, when he lowered me down to 50, I feel really great now. I feel borderline yucky, which is pretty good. That means it's working. So yay. I'm thankful for that. That's good. So yeah, that's what's going on. I go back to the doctor in a week. I'll have another dose of the trial drug, and then on next Thursday I see the pain management doctor that did the nerve block. I'll see him next Thursday just for checkup, touch base, and yeah, that's it. That's what's going on for now. So hopefully we'll have another good week.